What is Iloprost Ventavis? Iloprost Ventavis is an inhalation solution prescribed to treat adults with pulmonary arterial hypertension (PAH), a type of high blood pressure that affects the arteries in the lungs and the right side of the heart. It belongs to a class of medications known as prostacyclin analogs, which work to open up, dilate, the blood vessels in the lungs, improving oxygen flow throughout the body. By relaxing the blood vessels, Iloprost Ventavis helps reduce the workload on the heart and allows patients to breathe more easily and engage in physical activity with less discomfort. Common side effects of Iloprost Ventavis include cough, dizziness, headache, and flushing. These effects are generally mild but should be discussed with your healthcare provider if they persist or worsen. Iloprost Ventavis is administered through inhalation using a specialized delivery device called the INEB Adaptive Aerosol Delivery (AAD) system. However, this system has been discontinued by Philips Respiratory, so patients should consult their healthcare provider for suitable alternative inhalation devices or updated treatment options. What is Iloprost Ventavis used for? Iloprost Ventavis is primarily used for the treatment of pulmonary arterial hypertension, PAH, a chronic and progressive condition characterized by elevated blood pressure in the arteries that supply the lungs. The medication helps relieve symptoms such as shortness of breath, fatigue, chest pain, and lightheadedness, ultimately improving overall quality of life. How Iloprost Ventavis works. Iloprost Ventavis is a synthetic form of prostacyclin, a natural substance in the body that helps widen blood vessels and prevent blood clots. When inhaled directly into the lungs, it targets the affected blood vessels, relaxing and opening them to improve blood flow and oxygen exchange. By mimicking the effects of natural prostacyclin, Iloprost Ventavis reduces pressure in the pulmonary arteries and increases oxygen delivery to the bloodstream. This mechanism helps patients breathe more comfortably and enhances their ability to exercise and carry out daily activities. What are the side effects of Iloprost Ventavis? Like many medications used to treat pulmonary arterial hypertension, PAH, Iloprost Ventavis can cause certain side effects. Many of these reactions may improve as your body adjusts to the treatment. However, it's important to speak with your healthcare provider if symptoms persist or become more severe over time. Common side effects. The most frequently reported side effects of Iloprost Ventavis include cough about 39%, headache about 30%, flushing or skin redness about 27%, flu-like symptoms about 14%, nausea about 13%, lockjaw or jaw discomfort about 12%. These effects are typically mild to moderate and may lessen with continued use. Other possible side effects. Some people using Iloprost Ventavis may experience additional side effects such as vomiting, back pain, tongue pain or irritation, heart palpitations or rapid heartbeat, muscle cramps, coughing up blood, nosebleeds, difficulty sleeping or insomnia. If you notice any of these symptoms, let your healthcare provider know. They may adjust your dose or suggest supportive care to help manage these effects. Serious side effects. Although rare, serious side effects can occur with Iloprost Ventavis. Contact your healthcare provider or seek medical help immediately if you experience any of the following: bronchospasm, sudden breathing difficulties, tightness in the throat or chest, wheezing or persistent coughing, chest pain or pressure, severely low blood pressure, dizziness, lightheadedness or fainting, symptoms of heart failure, shortness of breath, swelling in the legs, ankles, or abdomen. Your healthcare provider may monitor you closely during treatment to ensure Iloprost Ventavis is both safe and effective for your condition. Typical dosing for Iloprost Ventavis. Iloprost Ventavis is supplied as a sterile inhalation solution in single-use ampoules, available in 10 micrograms or 20 microgram strengths. Using the INEB Adaptive Aerosol Delivery (AAD) system, each 10 micrograms ampoule can deliver 2.5 micrograms or 5 micrograms of Iloprost per inhalation session, while each 20 micrograms ampoule delivers 5 micrograms per session. The usual starting dose is 2.5 micrograms inhaled by mouth 6 to 9 times daily, spaced roughly 2 hours apart. If well tolerated, your provider may increase your dose to 5 micrograms per session, up to 9 inhalations per day. The maximum total daily dose of Iloprost Ventavis is 45 micrograms, 5 micrograms per session, 9 times daily. Never exceed the recommended dosing frequency, and always follow your provider's instructions carefully to avoid side effects or complications. Pharmacist tips for Iloprost Ventavis. Iloprost Ventavis should always be inhaled through the mouth using the INEB Adaptive Aerosol Delivery (AAD) system. Never swallow the medication, and if the solution comes into contact with your skin or eyes, rinse it off immediately. Before starting treatment, review the instructions carefully with your healthcare provider to ensure proper use. Iloprost Ventavis is available in 2 concentrations, so always confirm you are using the correct dose, especially if your prescription has recently changed. Do not hesitate to ask your provider if you have any questions about dosing or administration. Dosing schedule. You can use Iloprost Ventavis up to every 2 hours, but do not inhale it sooner, even if you experience symptoms of pulmonary arterial hypertension such as shortness of breath or fatigue. Work with your provider to establish a treatment schedule that fits your daily routine. Safety precautions. Dizziness and lightheadedness. Iloprost Ventavis may cause dizziness. Stand up slowly from chairs or bed, and avoid driving or operating machinery if you feel lightheaded. Blood pressure monitoring. This medication can lower blood pressure. Regularly check your blood pressure and notify your provider if it falls unusually low. Bleeding risk. Iloprost Ventavis can increase the risk of bleeding. Inform your provider if you have a history of bleeding disorders or are taking blood thinners, such as warfarin, Coumadin. Preparing the ampoule. Insert the ampoule into the ampoule breaker by aligning the blue dot on the ampoule with the dot on the breaker. Push the breaker away from the dot to snap the neck of the ampoule. Alternatively, wrap a rubber pad around the ampoule, keep the blue dot facing away from you, and carefully snap the neck with your thumb. Setting up the INEB AAD system. Use the provided pipette to draw the full contents of the ampoule and place it in the medication chamber of the INEB system. The inhaled dose is controlled by the dosing disc or medication chamber, which are color-coded to differentiate doses. Using the INEB AAD system, close the lid and latch, then attach the mouthpiece. Turn on the system according to the manufacturer's instructions. Inhale slowly and steadily through the mouthpiece. Treatment sessions typically last 4 to 10 minutes. After each treatment, discard any leftover medication in the chamber. Safely dispose of the ampoule top and the broken ampoule to prevent injury. Talk to your healthcare provider to ensure proper use of Iloprost Ventavis. Always follow your prescribed dosing schedule and report any unusual side effects immediately. Consistent, safe use of Iloprost Ventavis can help improve your breathing, exercise tolerance, and overall quality of life.